Hey everybody, it's me back again with another video. Long time no see. I just wanted to come on here and update you guys on what my second semester was like. So if you're interested, please watch. So second semester, needless to say, was way better than first semester. First semester is probably going to be the hardest semester that you'll ever endure. Well, as far as I know so far in the program. If you are about to go into nursing school, first semester will probably be the hardest because it's just a transitional period. You getting to know what is expected of you, all of the exams, how to study, how to do well in your clinicals, etc., etc. But anyway, second semester compared to first semester for me was like night and day. So second semester, I had peds and I also had my OB rotation. So the semester began in January, I want to say January 14th, 2019, ended for us in the end of March. And then that's when we went to our OB from March to May 22nd. So for peds, it was interesting and made me want to kind of put that on my radar as far as what I want to do when I finally become a licensed registered nurse. So for peds, we had to go over all the developmental stages of a pediatric patient. So you have to be familiar with that in order to do well when you become a pediatric nurse, if that's your interest, or to even communicate with children or adolescents. So that was interesting, getting to know all of that. It was a refresher for me because I majored in psychology at community college anyway. I was on my way to get my bachelor's when I decided to stop and go for nursing. So there was that. We had a lot of interesting opportunities in the clinical. Not so much hands-on because the pediatric clinical was more of, their parents are there, they want to do all their care for them, and basically passing meds is what you do. Even then, at times, passing meds, if it's a pill or, if a diabetic or an insulin shot, a parent would want to do it. So parents are more hands-on, and your role would just be to come and to make sure everything is going as it should be and that the patient is comfortable and okay. So with that, I felt like there was less hands-on for us to do in comparison to a med-surg clinical rotation. So there was that. Learning how to communicate with the patients. We had sim labs, which is just a simulation of dealing with a pediatric patient who has a specific type of disease. In the clinical, the main disease kind of condition that we encountered was more RSV, respiratory types of issues, asthma, and there was one patient who had Kawasaki's disease. If you don't know what that is, go look it up if you're about to enter into second semester. And then for us, when there was low census on the floor, we were floated to the NICU, which was interesting because I like babies. And I also got to see how a different side of these types of nurses, because they're sitting down most of the time. They're right next to their baby. If their baby's in critical condition, they are assigned one baby at a time. If they're a grower and a feeder, as they refer to them, just, a preemie that's trying to gain weight so that they can be stable enough to go home, then the nurse might have 3 at a time. And so there was a lot of feeding going on. There was a lot of assisting with inserting PICC lines for babies who have, unfortunately, syphilis. And so we had to get some vancomycin into them, some penicillin. And so got to assist with that. The downside of that was that the person that was inserting the PICC line had to stick the baby like 5 times. And fortunately, the baby wasn't in much of distress because we were feeding him the sugared water at the same time. So, but, still, I think if it's my child, you have 2 chances to stick, and that's it. But the parents weren't there, and some questionable things that go on at the hospital that are not in line with what you learn as a nursing student, but it's just what their shortcut, their short way of doing things. And not judging them because I don't work as a nurse yet, but basically they improvised. And you know, I'll see how it goes when I'm a nurse, and my plan is to do everything safely. I'm not a nurse yet, as I said, so I don't know what they go through, but as long as they're being safe, you know, it is what it is, I guess. But that baby really did need the penicillin, and I guess it's hard trying to find a baby's vein, a newborn's vein, in order to get that PICC line in. So anyway, aside from that, so one half of the rotation at the beginning was clinical. Then the second half, we had to go out to the community. So that involved going out to schools, following a school nurse, giving a presentation to a high school. So we were each assigned a condition. So my condition was shock. And so I had to develop a PowerPoint presentation and then go and give a presentation to 3 high school classes that day. The good part of that was that we got to go home early on most of those community rotations. Another rotation we did as far as the community was I went to a special ed school, or a school for special children, and these children mainly had conditions that limited them to a wheelchair, or you know, had issues where they needed total care. And so I got to follow that nurse with how she sets up her day, and that for me was very humbling, and is something that I think maybe I would also look into if I became a pediatric nurse. I would love to assist with that, or to do that, to care for children that need assistance. And so with that, I came out of that class with an 89.47%, and that bugged the crap out of me. I mean, if I'm going to have a B, make it a solid B, you know what I mean? But when I'm on the border, or on the cusp, or on the verge of getting a different grade, then that, I mean, a different grade going up, then that bothers me. And, but you know what? I'm happy that I did pass. Secondly, in OB was the thing for me. I loved OB. Through and through, I loved OB. Oh my God. It was the best rotation yet that I've had. First of all, clinical instructor, she was so down to earth and made you believe that you could do this. And the best thing about this was, so I did my rotation for both peds and OB at a general hospital, which supposedly serves the disadvantaged population, people that may be on Medi-Cal or have limited income, things like that. And so in my peds clinical rotation, we had a cool instructor. She was awesome. As far as nursing care plans, we had to do them verbally, orally, in the post meetup with our clinical group, which is like an hour before we are supposed to leave clinical. And so we just verbally give our nursing care plans, walk through all the nursing diagnoses we come up with, all of the interventions we would do, and all of the proposed outcomes that, or all of the outcomes that should have happened by end of shift with our SMART goals. And she was very nice and very easygoing and not anxiety provoking for me, who is somebody that I am somebody that's prone to anxiety. So it was nice to find out that when we did our OB clinical, I chose the same hospital. We got her best friend, who was also down to earth and also happens to be the head of the labor and delivery unit. And so she was high up there in their leadership. And so this was her first time teaching, and she was kind of a last minute hire because they needed someone at that hospital, but they're now considering her for permanent, permanent position for this, for as a clinical instructor. But anyway, she was down to earth, made us feel comfortable, always found out if any of the admits or the patients that were newly admitted needed anything that we would be looking to do as a skill, such as insert IV catheters or start a catheter or a Foley catheter. And I got to start 2 IVs on a patient and got the poke 3 times. I mean, 3 different times I was, okay, let me back up. So 3 times I was able to start an IV on 3 different patients, and each time, the first time that I started it or inserted the catheter with the needle, I got the vein and didn't blow it, and I felt like an accomplished nurse. So the first, sometimes I would start it here, other times I started it on the forearm, and my clinical instructor was very impressed, and I was impressed with myself too. But yeah, definitely made me feel like I'm on the road to becoming a good nurse or becoming a nurse. I didn't get to do a Foley catheter, unfortunately. Other students did. I was vocal about asking for it, but unfortunately it was too late. It was like the last day of clinical. But aside from that, OB rotation was awesome because of just the variation. Like, you can be in postpartum one day, you can be a labor and delivery nurse one day, you can be taking your patient into surgery, a C-section, and it's just right there. So there's different aftercare and protocols you have to follow beforehand and afterwards, following the fetal monitor, the toco monitor, and just, administering medications, which I did for one patient who was came in because her baby was about to, well, she had a spontaneous rupture, and so that means her water broke, and so we had to keep the baby in because it was too early for her to give birth. We had to keep the baby in and give her an injection so that the baby's lungs would stay inflated, and so that was an experience too. But there's limited medications that you need to remember. They use the same throughout everything. Our sim lab was based on a postpartum hemorrhage, and they basically let us know what to do, and then we went in our groups and we tried our best to perform it. And I felt that was very beneficial because we actually got to see what it is we're supposed to do, and then we got a chance to go in and try to perform it. I felt like that was more beneficial than like going in blind and get blindsided about what it is you're supposed to be doing. But anyway, everything about this semester was awesome. Nursing care plans for OB was done as a daily work plan. So every day in clinical, which is, for the state of California, for some reason, you don't need as many hours as the other rotations. So we didn't get a whole lot of clinical days, probably about 9 clinical days, I think. And each day we did a daily work plan for the patient that we were assigned to, which consisted of vital signs, things that you can get from her chart as far as history, and coming up with the diagnoses and interventions and things like that. And we also had to do a newborn assessment on a newborn, so we would walk through that. We did the assessment, and we had to complete our report on that, which also consisted of a nursing care plan. So that was that. And we also did an oral presentation. It seems like that's going to be the thing that we need to do for each semester and each course. So we did an oral presentation, and mine was on, you have to pick a condition that has to do with labor and delivery or pregnancy. And so I picked postpartum depression because I think it's important. amongst other things, but highly important and I think overlooked a lot of times. And so I did my presentation on that, got an A on that. Had to take the final a day early because the date of the final was on my son's graduation and I wasn't going to miss that. So I set up, I asked the teacher if I could take it earlier, and unfortunately in my program you get a 10% deduction, but a 10% deduction is better than not being able to arrange that at all. And I know some programs don't allow you to change the date or anything for an exam, much less the final exam. So I did get to take that exam a day earlier, took that 10% deduction. Without it, I would have missed 3. But overall, I passed that exam and passed the class with an A. So I'm happy about that. And looking forward to 3rd semester. Right now, I'm just going to chill and take my summer break. I was going to work, but I feel like I've been working all this time and I have 3 little babies that, well, a 5-year-old, a 3-year-old, and an 18-month who could probably use some mommy time since I've always been studying this past semester. And so I'm going to focus on them and get that time in with them and take them to go see things, to go experience things while we are both on summer break. And, you know, just chill. Because I know come August, it's hit the ground running time again. And this coming up semester will be med-surg and mental health, nursing, or psychiatric nursing, intermediate mental health. So looking forward to both. I've heard that this could probably be a hard semester, but we'll see. I'm ready for whatever they throw at me. And as far as myself and looking at how I've grown, because I'm not trying to compare myself to others, I stopped telling other people my grades. I just tell them whether I pass or not, because I'm not looking for the comparison here. And people in the nursing program are definitely competitive and are trying, I can tell that they're trying to categorize each person or, you know, try to make themselves feel better about their grades. And I'm not for that. I'm trying to be better than what I was yesterday, as I mentioned in another video. And that's exactly what I came here to do. If I had to review myself on how my performance was this semester, I definitely did better. I asked for what I wanted. I stepped up to the plate. I volunteered first for things. I definitely see growth, and that's what I'm in this for. I'm trying to improve. And so, yeah, performance-wise and growth-wise, I give myself an A+. I still have doubts if I could do this overall, but I'm shoving that down. I still have anxiety. Feel like that's going to be the running theme of the program, but you go and you do it anyway, and that's what I've been doing. Cliques have formed. That's what will happen, especially after first semester. You connect with those people, or you don't connect with those people, and so second semester comes along and you connect with people there, but those people mainly have established cliques already, and so it is what it is. I figure when this program ends, most of these people I won't even be talking to, if any. But yeah, that's how this semester went. I feel like as far as future plans, I plan on, in the middle of the 3rd semester, applying to the state college in my city for the RN to BSN program immediately. So I'm going to apply in October, and then when the application opens up in February of 2020, I will be in 4th semester, my last semester of nursing school, but I'm going to apply for their RN to BSN to get in immediately. However, one of their, in their admissions process, it says that if you are currently a working RN, you will get priority admission. So there goes that, but I'm still going to apply. Plan B is to look into WGU RN to BSN program. It's all online, and I heard some good things about it on YouTube, in the way that it costs $3,000 a term, and their terms are like 6 months each, and it could be up to 18 months to get your bachelor's degree. And so, but you can do it in one term, which is 6 months. So I suppose I would need to bust my butt trying to get that bachelor's degree if I were to do it in 6 months. But 6 months sounds, 6 months for $3,000 sounds awfully good to me, but we'll see. And another thing for my OB rotation, the head of the department, as I mentioned, was our clinical instructor, and she even told us over and over again that she's always looking for nurses. And it being a general hospital, they do hire associate's degree nurses without experience. So in a specialty, normally in a specialty like labor and delivery, they hire you at other hospitals if you have experience, like a year or so or more. And at that general hospital, they don't. They just hire you. And so even though it's like an hour away from where I live, I might consider that, just because she said that. She said she would remember us. So I would love to get that. The only thing is they have high turnover, because once those students get that experience, they go for the other hospitals, because general doesn't, it being a county hospital, doesn't pay as much as others. But I'm willing to sacrifice that to get the experience. It sure is more than I was making before, so not much more, but it's more. So that is something that I would consider when the program is done. But anyway, I'm happy to know that I'm halfway through the program. It still feels far off, but I think by the end of this year, come December, when I'm done with the 3rd semester, it'll hit me a little bit more and I'll feel more happy about it. But you know, it is what it is. At least I'm not in the 1st semester. So yeah. Anyway, I just wanted to update you guys on this, let you know how I'm doing. This video is rambling on, but I just wanted to get the whole experience out there. It was awesome. It was the best so far, thus far. Got to learn a lot. I'm going to be doing a video about the resources that I used. I have many, like a handful of supplemental resources that I used to get through this program. So maybe you'll find them of use. I'll do a brief review on them, or just let you know what they are, and then go more in depth per supplemental resource in different videos, if that's what you want. Anyway, hope you all have been well. I hope if you're going into the nursing program this fall, good luck to you. And if you're still working on your prereqs, good luck to you as well. Try for those A's, but you know, do the best that you can at all times. If you get a B, that's what it is. If you get a C and you just pass, that's what it is. You did the best you could. But of course, if you want to move up after your program, if you have an ADN or if you have a bachelor's and you want to move up, they do look at those grades. So just keep that in mind. Just do your best, but don't kill yourself about it. Don't kill yourself over it and kick yourself when you don't get an A. Sorry. But anyway, I will talk to you guys later, and I'll have that video coming up soon. All right.